Hello.
Hello,
Hi.
nice to meet you.
Very nice to meet you too. Thank you so much for doing this with me today.
Sure, yeah. Yeah,
So, as you probably already heard, I've started recording the meeting. I
yeah.
set it up to just do an automatic record so that I wouldn't have to fuss
Yeah,
with that part.
that sounds good.
Yeah, great. Okay. So the first order of business is I would like to know how you pronounce your first name, because I've heard a couple different options.
Yes, so it's Matthias, or you can also call me Matt. I think it's easier for everyone.
Oh, so most
Matt,
people
so
call you
just
Matt.
Matt is good for me. Yeah, yeah,
Okay.
definitely.
Okay.
Yeah.
Great. Wonderful. All right. So what I'd like to do is just
Mhm.
go through kind of chronologically,
Yeah, yeah,
sort
sure.
of, growing up and then to where you are now.
Yeah.
So let's just kind of start at the beginning and tell me a little bit about what it was like for you growing up.
All right. So right now I'm 32 years old and I was born in France. And I was diagnosed with it's called CFTD. So it's very close to Nemaline. It's just similar kind of disease and very, very close. So I was diagnosed like during my first 6 months because I had hypotonia. And so basically I had muscle weakness and I was not moving a lot. And my mom could not feed me very well because I was sleeping during breastfeeding. So they knew that something was wrong at this time. So they did like multiple tests. So it was in 1990. So at this time we didn't have like sequencing or we didn't know the gene for Nemaline, myopathy or CFTD. So we didn't know a lot about those kind of disease. And when you have a child with hypotonia at birth, they say usually, okay, we will see, but we don't know if like next year your son will be here, just because they didn't know. So you have to be prepared. This is what they told to my parents. And then I grew up. I gained motor function, and I went to school like any any kids, had friends, and but I had muscle weakness, so it was like the main issue for me. I could not like work very fast. It was hard for me to play with my friends, stuff like that. And then I had like scoliosis, and I also had like a decreased respiratory function around 15 years old. And so at this time, they started to do a non-invasive BiPAP overnight. And so I'm still on it. So basically, this is a machine that helped me to breathe, like during the night is giving me the air and taking back the air, from my lungs. It's just basically a machine that does the work of my lungs, basically during the night. And at this time, I was very interested in science because basically we didn't know about the gene and the cause of my disease because I was the only one in my family. And again, it's very rare, so we didn't know, the doctors didn't know about it. So I was very interested in learning about my disease and in science in general. So I did a bachelor in science and I got a master degree in biology. And then I did my PhD in France, working on the muscle cells, just trying to learn about muscles. And at the same time, one of my physician was also a member of the lab, and we discussed about my disease. And I told him I just read a few papers in the literature, about similar disease, similar symptoms. And I say, oh, we should try those genes, we should sequence those genes and see if I have a mutation in those. And so what I did,
And what year was that?
so it was in 2015. So
Okay.
8 years ago, 8 years ago. And so I was talking about like three genes. It was TPM2, TPM3, and ACTA1. So those genes are known to be involved in congenital myopathies, and people had very, very similar symptoms and also similar biopsies. When you look at the biopsies under the microscope, basically my muscle looks the same. So I say we should like look at those genes, and basically 3 months later they told me that you were right, and one of the gene had a mutation that it's already known causing CFTD, and so it was a mutation in the TPM3 gene. And my parents didn't have this mutation, so I was the only one. So it's called de novo mutation. It's basically when a mutation appear like sporadically in a family, but we don't know why. But sometimes it can happen. Maybe like your parents don't have the mutation, but you can have it. So it's called de novo. And
Is yours considered to be a dominant form? So
so yeah,
just
it's
one.
it's a dominant form. So yeah, basically, if I have a child, I have like 50%, I would say, chance to give this disease because of the dominant trait. So yeah, it's a dominant mutation. Yeah, yeah. And so then I finished my PhD in France, and I came to Boston here in Massachusetts in the USA to do my postdoc. So I went to the lab of Dr. Conker, who is working on muscular dystrophies. So, for example, Duchenne muscular dystrophies. And so it was 6 years ago I started in this lab. So I worked on Duchenne, and at the same time I started to work on my own disease, because next door we have also Alan Beggs on this floor, and he is well known for working on congenital myopathy. So I was working also with him to launch some sort of project, and now I'm almost like 100% working on this project, and I got funding from NIH, MDA, Muscular Dystrophy Association, also the Muscular Dystrophy Association in France. It's called AFM Teleton. And so now my goal is to launch my lab in the next year or two here in the US, focusing on TPM3, congenital myopathy, but also on other Nemaline myopathy. So yeah, this is my goal for the next few years, is to have a lab and really focusing on this kind of disease, like rare disease. Yeah.
Fantastic. That is such a great summary. I'm just curious, did you ever have a muscle biopsy? And did that ever show Nemaline rods?
So I had a muscle so actually two muscle biopsies, one at 6 months of age and one at 10 years old. And every time they didn't show any Nemaline myopathy, Nemaline rods. But it doesn't mean that I don't have Nemaline rods,
Yeah.
because if you think about it, they take like a very small piece of muscle, it's very small, and then they're gonna check on one or two sections of this muscle, and the section is maybe like 8 or 10 micron, so it's very small. If you think about it, it's very small. So it doesn't mean that I don't have Nemaline rods, but they didn't see any Nemaline rods, and what they saw, it was a selective atrophy of the type 1 fibers. It's also called slow fibers. So this is the fiber used when, for example, when you stand up, when you try to be straight on your chair. So this is those muscle resistant to the fatigue, and those fibers doesn't work for me. And yeah, this is what they saw. But usually when we say CFTD, so it's when you don't see the Nemaline rods, and when you have Nemaline rods, the symptoms and I would say the mechanism behind the disease are pretty much the same. And that's why, we usually work on both at the same time, because, for example, in TPM3, like 50% of the patient, they're gonna see Nemaline rods. in the biopsy, and in the other 50%, they won't see that. But the symptoms will remain the same. So that's why we are working on both. Yeah.
So is the thought that those two are probably the same disease?
For me, yeah, we have like a very strong overlap
Yeah.
in this disease because one example is, so yeah, we had examples in the past, for example, with patients that had two biopsies for TPM3. He has a TPM3 mutation. In the first biopsies, they didn't see any rods, and in the second biopsies, they saw rods.
Mhm.
So
And
I would
it
say,
was the
well,
same muscle that was biopsied?
sorry.
Was it the same muscle and approximately same site that was biopsied?
I think there were two different muscles. So that's also the thing, like rods can be different muscles. It also depends how you use your muscles. We also see, like, for example, in the same family, like two, like for example, one brother, one sister with the same disease can have a different biopsy, like a different, pictures of the biopsy under the microscope, and one we have Nemaline rods, and the other one no, but we don't know why.
Mhm.
But when you look at the symptoms, they are pretty much the same. So for me, I am, I'm more like, yeah, it's there is a huge overlap, and I mean the consistent things between Nemaline rods and CFTD. It's in both cases you're gonna have an atrophy of the slow fibers for TPM3. And so for me, this is what we should look at in this disease. And what I'm trying to do in the lab right now is to look at, the size of the fibers, and if we have any correlation, if you have smaller fibers, do you have like a more severe disease or not? This is what I'm trying to do. Yeah.
Are you using animal models or human tissues mostly for your studies?
So right now it's mostly animals. So we have a zebrafish model, and we are about to have a second zebrafish model for TPM3, and we have also a new mouse model that we made with CRISPR in the lab. So basically, what we did, we introduced a patient mutation in this mouse to see if the mouse developed Nemaline rods or CFTD, and if there is any symptoms related to myopathy. Yeah.
And what have you seen so far in that model?
I would say this model is pretty good because the symptoms, at least in the biopsy, is very similar to the human. So we have an atrophy of the fibers, and right now I'm looking at the rods. But yeah, definitely there is, we call it a phenotype. So we have something very similar to the patient. So I'm very hopeful, and um, I I hope in the future we can use this model to try treatments uh, and see, if a treatment is working, we can then go to the human, to the patient. But yeah, this is also the goal, is to develop this model to use treatments. Yeah.
Absolutely. I just have another general question.
Yeah.
So with some types of myopathy, we see fatty replacement of the muscle cells.
Yeah.
Is that something that's occurring in TPM3 myopathy as well? And what can you comment on that?
So they saw, like, they did like, some MRI in some patients, and what they saw is sometimes, yeah, some fatty infiltration in the muscle. Not a lot. Is not like, for example, when you have like muscular dystrophy, and when you have a progression of the disease, when you have a huge replacement. I would say for TPM3 it's very mild, but yeah, definitely you have some. And right now we don't know if it's progressive or not. Uh, this is something that we would like to see in the patients. For example, if you can do like maybe just different MRI at different ages. And the good thing is, and it's not invasive, so it's not like a muscle biopsy. So you just have to take a picture of your body, basically, with the MRI, and you get the results, and you don't have to take a piece of your muscle. So it's also something I think in the future we can do is just based on MRI. You can say you have a myopathy or not. That would be a new thing to do because I know like uh, taking a muscle biopsy is not easy, especially when you're a baby. And I can understand the parents, when we say, oh, we should take a biopsy to see if your son or your girl has a disease, has a myopathy. But I can understand that it's not an easy decision. And
Mhm.
so I'm also looking for other strategies, non-invasive, less painful for the patients and also for the muscle. And so I think MRI could be a good way also to do that. Yeah.
Absolutely. Can we go back just
Yeah.
briefly to your college phase of life?
Yeah.
I would like to know more about what that experience was like for you. What were some of the challenges that you experienced that were connected to your form of myopathy? And also, what are your best memories of that time?
Um, so I remember just it was very, difficult for me when I, went to school, for example, is to, you know, have my bag in the back, like carrying my bag. It was very difficult, so I had someone helping me with this. Um, I could not, like use the stairs, so I had to take, the elevators, and usually the elevator were not for the kids at school. It was just for the professors, for the teachers. So I had to ask for the access. So it's there's a few things, that can be a struggle because at the time, I was very shy, and so I was not asking for it. And so I was every time, when people say, "Oh, what are you doing?" I would say, "I'm fine." But I was very tired. I
Yeah.
can say that. And at the same time, I was like around, yeah, 15, 17 years old. And at that time, I started to have like a very severe scoliosis. And so doctors say, we should do a surgery for this. And I was very scared, like very, very, very scared. And also I was not like in wheelchair. So I say they wanted to do a surgery, from the neck to the back, to the end of my back, and I say, what what are we do in the future, with that? I was scared, and I took the decision to not to do this surgery. So I didn't have the surgery, and I would say today I'm okay. I don't have any soreness in my muscle or any back pain. So fingers crossed. But today
You
I'm okay.
never did have spinal fusion?
No, never. I didn't took the decision. I say no. I
Yeah.
say no because I was scared. I was
Yeah.
I was just scared, and I didn't want to. I mean, I assume my decision, it's my decision. I also talk to my parents, to the doctors, I try to do the balance between the cons and the pros, and let's say, I want to do my life as I want. This is
Mhm.
every time what I say, every time I took decisions, sometimes it's good, sometimes it's bad, but every time I assume my decision. And so that was one decision. And so it was a very big decision because when you think about it, 17 years old, usually you want your driver license at this time, and you don't think about the back surgery, that will change your life. Maybe you want to go to college, you want to leave your house to go somewhere else, to go to university. And this time I say no. It was like a huge decision. So yeah, that was one thing. And at the same time, because of my scoliosis, I had very bad pulmonary function. So we had to also to do the BiPAP and overnight. And it was also very difficult for me. It took me like 2 years to get used to it. Like
Yeah.
2 years to, I had to wait 2 years to have a full night with this, with the machine. And not today I'm good. I mean, I think this BiPAP saved my life because the test and the results were very bad. And I mean, today I'm okay. I mean, and yeah, there was two two big moments when I was young, very difficult for me. Uh, I had some sort of maybe depression because of this. Also at some point, I think because I saw that my disease was progressing, and at some point I wanted to give up, just to give up, just say okay, the disease won, my disease won, and that's it. Basically, that's it, you know. And then I think at some point I don't know, just wake up. This is at the same time when I met my new physician, you know, who gave me some hope and say, well, you can still do things, you know. And he told me, okay, you want to do science, and we have a lab in the city where they do where they do muscles, you know, like muscle science. And I say, okay, let's do it. So I went there for a summer internship, and then I stayed there like for 5 years, and I did my PhD there. So and then I went to Boston, and so yeah, I mean, that was a huge moment.
And that reminds me of something else I was going to ask you
Yeah,
about.
yeah.
Who was really influential for you in your life, helping to kind of steer you towards science and the path that you're on now? Who was it that inspired you the most? It sounds like this physician was one of those people.
Well, definitely this physician who is now also my colleague, you know. Um, I also like science, but also like, you know, to have like motivation, you know, like resilience. And, you know, I like sports. And when I was young, my dream was to be a professional, to do like a professional soccer, you know.
Oh, sure. Uh-huh.
And
You and
and
a lot of other young people, I'm sure.
yeah, and I just realized that it was not possible for me.
Yeah.
But I really like sports, and you know, this kind of, you know, resilience. You know, sometimes you lose a game, sometimes you win a game, but you have to keep going, you know. And this is
Mhm.
basically what I have with my disease. You know, someday I win, someday I lose, and but yeah, you need to have like a long-term goal in your life. And I know science was something that I knew that I had a role and a place in the society, basically, and it was very important for me. And I think doing science, I found like a good place, you know, like a meaning definitely in my life. I say I can be useful, you know, in this field because I knew like some things, and I have this disease, you know, which is a big experience in science. You know, usually what I say, you know, my disease, I had a 30 years experience in muscle biology just because of my disease, you know, and this is something that no one can have this in their CV, you know, say, okay, I have a PhD, okay, but I have also a disease that I'm living with this disease for the past 30 years, and I think it's a big plus in my career. And I now I take that as a positive thing, you know, as a plus, and not as a negative thing, because there's also the thing when you have a disability, you know, there is the thing that people think, you know, like it's a negative thing, you know, to be, you know, in a wheelchair, to have a disease. And I think it's sometimes the opposite. You know, you can bring so much to the society, to people that do not know about, you know, rare disease or living with disease, or, and I think it can bring so much. And I think we have we all have a role in the society, and mine is in science. And so, yeah, this is what I do every day.
Absolutely. And I'm really glad that you mentioned that because I've always thought that what we need most in society are those people who have the experience and the personal motivation doing the jobs that are not just jobs to them, right? It's their life, it's their passion. It has so much more meaning to them. And that's one of the reasons why I was just really excited to learn about your background and what you're doing now, what your future plans are. So I know that you were awarded the development grant last year
Yeah.
by the MDA.
Yeah.
So one of the other things that I hoped we could go over is, kind of what your plans are, if you started any work on that yet.
Yeah.
So
Yeah, definitely. I mean, I can definitely talk about what I'm doing. So yeah, I got a development grant from MDA. I also got a development grant from NIH. So both grants um, are made for people who wants to have their own lab in the next 1 or 2 years. So this is my goal. So I'm still a postdoc right now at Boston Children's. So I don't have my own lab. I still have a mentor. But the goal is I want to take my independence in research and to have my own lab. So this is, yeah, my goal in the next year is to apply for a position in academia in the US. So it can be Boston or somewhere else, but yeah, that would be to have my own lab. And so right now, what I'm doing, so we made the different models, zebrafish and mice with TPM3 mutation. And what we are doing right now is to study the difference between the different type of muscle fibers. So you have the slow muscle fibers and the fast muscle fibers, which are different. And what we saw in the patients and in those models, the slow fibers are small compared to the to the fast fibers. And this is something that we would like to understand, and we are looking at the mechanism to those two different fibers, and to see if we can find mechanism that can explain a bit better the disease, and if we can use those mechanisms to design therapeutics to, for example, to stop the atrophy of the fibers, to have a better growth of the fibers, and basically to gain some muscle function for the patient. So this is our goal right now, is to dissect the different molecular mechanism in different muscle fibers. And I think it's very important because in the past, people usually didn't know the difference between slow and fast. So just, look at the muscle and say, okay, we have this different mechanisms involved in the myopathies. But I think it's very important for TPM3 to look at in the details in different fibers, because we know from the patient that slow and fast are not responding the same to the disease. And so we are also wondering if we can use the fast, because they look healthy in patient. And so if you can use your healthy fibers to maybe, like compensate the disease and decrease the symptoms. So it's a new area, and I would say new hypothesis in the field, and this is what we would like to do in my lab in the future. So yeah, we are working on those studies right now. Yeah.
So it sounds like you're saying the fast twitch muscle fibers appear healthy.
Definitely in the patients so I'm just looking right now for TPM3.
Mhm.
Yes, definitely they look healthy, and even they look what we can see in some patients, we have also hypertrophy. of the fast fibers. And so it's very interesting because it looks like the muscle naturally is trying to compensate the disease. And so we are looking, at this and say, if we can push a little bit the fast, healthy fibers to compensate the atrophy of the slow fibers, that could be a huge game changer for the patient. And it could be, like in a way that, we do some maybe kind of exercise that would train specifically the fast fibers. That would be, small molecules like, that you take, like a drug every day, to help you maybe with your metabolism and your muscle to target those fast fibers. And at the end, we are also looking for gene therapy, also to target both slow and fast. But I'm very hopeful about the fast because it's definitely something that we should look at in more details. So this is what we are doing right now.
That's really interesting.
Yeah.
Um, could there possibly be a pathway where you're somehow innervating the healthy looking muscle fibers to do the work that the slow twitch muscle fibers would have done? So maybe a nerve pathway too?
That could be a nerve pathway, definitely. That could be like different pathway, and this is what we are trying to look at right now, is to
Yeah.
look at all of the mechanisms, involved. Basically what we like to do, for example, in the mouse is to take a control mouse, with no disease, like a control, like healthy mouse, and take a mouse with a mutation, and basically we would like to compare both muscles and both fibers and say what are the mechanisms involved in the atrophy of the slow fibers first question, and what are the mechanisms involved in the hypertrophy, or at least, at, involved in the normal size of the type 2 healthy fibers, and the goal would be say, okay, maybe we can develop a treatment to target the slow fibers, but we can also design a treatment to target the fast. And so that would be like two complementary treatments, maybe. That can be one thing. Maybe we will also discover a new mechanism that were not discovered before in the muscle biology. So it's also very exciting for us. And I think also we're also taking a new approach in the disease because again, if we have like some healthy fibers, the goal would be to try to keep those healthy fibers, and maybe they can work a little bit more for us, and so they can compensate the symptoms. So yeah.
That's
Yeah,
fantastic.
yeah. I think maybe we don't know, but maybe the solution is it's in our body. Maybe we just need to push a little bit the fast to gain some muscle function, and maybe you will, instead of working for 5 minutes, maybe you will work for 10 minutes. This is what I hope for me. For example, or if I get a little bit less tired, or that would be awesome. So yeah, this is a goal in the next few years.
That's fantastic. So we just have about 5 minutes left, and
Yeah,
I,
yeah,
I want to be respectful of your time.
sure.
And then also just give you an opportunity in this last 5 minutes. What
Yeah.
else would you like the Nemaline community or the TPM3 specifically community to understand about you and your work?
Um, I mean, what I would say, is that so I'm right now, focusing on TPM3, but any mechanism that we will discover can be also potentially used for other myopathies, not only TPM3, but it can be for Nemaline, ACTA1, SEPN1. We have over 20, 30 genes, involved in myopathies and also Nemaline myopathy. So it's one thing that we hope is what we will discover in TPM3 can be used also for other Nemaline myopathies, because we have, I believe, also similar mechanism, similar pathway, and similar treatment that could be used, for all of us. So this is one thing I would like to emphasize is, it's not because, one lab is working on one gene that it will be only for this disease. It can be for the entire community. Another thing is, for me, it's important for the patients and also for the scientists is just to speak up, I would say, about, like, be your your own, voice and in the community, and if you want, I would say, sometimes, some patients, like, contact me, saying, "Oh, can you tell me a little bit more about my disease?" Or, "Oh, I have my son has a TPM3 mutation." And I think it's great, to talk to the scientist, because I think the patient has to be at the center of the research, and not at the end, like, at the end of the chain, but I would say at the center. So I think it's very important for the patients to be involved in science, in any form. Um, and one last thing, so not only science, but just for people and for the patient, just um, as I did, just believe in your dreams, I would say. Uh, do what you want to do. If you want to go to science, do to science. And if people tell you that you cannot because you have a disease, tell them they're wrong. Because there are paths to go to science, even if you have a wheelchair, even if you have different disability. I think it's very important to step up, speak up, and be involved, in this kind of things. And it's very important for us, but also for the next generation that will come. So this is what I did, like in 1990, when you had disease, in the past century, like sometimes it was like, you wanted to hide people with a disability. You will not see a lot of people in the street with a wheelchair because, for some families, it was a shame, or some people, they didn't like people with disability. And now we are trying to see more and more people involved in the society and, for example, in science that have a disability. So again, if people that have Nemaline myopathy wants to be involved in science, doing science, like doing, for example, I don't know, like going to a lab, or doing like fundraising, or going to, like a conference to meet scientists. I think it's great because it will help, moving forward, and also help the scientists to do their work and find, like a cure, because this is the goal that we all have, is to find a cure for the patient. So yeah.
Absolutely. Well, thank you so much. I
Thank you
really
so much.
appreciate your time
Yeah.
today. This has been fantastic. And this is going to be a wonderful resource for our community.
Yeah. Thank you so much.
Thank you. Take care. Have a great day.
Have a good day. Bye.
Bye bye.